Thanks for joining us. I'm Bobbie Pottorff, the new host of Newsmakers. Regular viewers of our program know that longtime host Judy Stiles retired after 35 years in broadcasting. Welcome to the new Newsmakers. Our first guest today is Ryan Talken, Director of Joplin's Health Department. So Ryan, I bet you're one busy guy. I mean, emails, phone calls, how busy is it?
You know, really for the last year, really, this all began about a year ago, March of 2020. We, as the health department, we've been very busy. Our staff, nursing staff, as a whole, we've been kept on our toes the entire time. It's changed over the course of the time. At the beginning, of course, it was all the newness of it and getting all the isolation, quarantine, all of that systems figured out, additional staff hired on and such. And now it's kind of morphed into the vaccination programs.
Oh, right. So tell us where things stand right now with Joplin's COVID numbers.
Sure. So were you going to pull up the data? As of right now, we have 5,869 total cases. We have 124 deaths within Joplin residents. And these numbers that I'm citing are the Joplin numbers. So there's Joplin and also Jasper County and then also Newton County.
And they're all three separate.
Yours are just three separate. Mine are just the City of Joplin numbers. And as of right now, we have 32 active cases.
Oh,
so if your viewers are looking at our dashboard, the data on there, it updates every evening. So as of right now, we are not conducting case investigations on Saturday, Sunday, just because our numbers are low enough. And the way that the laboratories report, Saturday, Sundays are kind of typically lower days. And so
that's the
the contact tracing. And so the positive labs that come in are typically lower on Saturday, Sunday. So the website will update tonight, and that should reflect any cases that came in tonight, being Monday night.
And you say 32, is that hospitalized or is that
active cases? Yeah,
okay.
That's just 32 total cases. I don't have the actual hospitalization numbers available right now, but the hospital trends have been going down, considerably down. There was a little bit of an uptick this morning. I looked at them, but not anything of any real significance.
Great concern, yeah. And so that leads me to the next question of the mask ordinance that was recently allowed to expire. What was the city's perspective of the number of cases once that went into effect? I mean, was it a significant drop real fast? Was it gradual? How did that?
Oh, I think there was a couple of factors that was brought into that consideration. And, it was the number of overall cases, the positivity rates, hospitalization rates. There's a number of factors. COVID, the controls, it not only protects the individual, but it also protects the entire system. Right. So at the end of the day, hospital rates matter because you don't want the hospitals to become overrun, basically, with COVID care and COVID patients. So masking played an important role in that, and as the hospital numbers come down and the vaccine rates go up, all of those things contribute to being able to lift those.
Right.
So in the future, we'll keep a close eye on that.
And the city, did they also lift the restrictions for capacity in restaurants?
They did. So the mask ordinance is a separate ordinance
Right.
from the response and recovery plan. So the response and recovery plan, there were some recent changes made on that. The recent changes were that the mass gatherings outside, the limits on that were previously set at 250, and those were removed.
Okay.
So of course we would still urge people to practice, social distancing and hygiene, all of those things. And then the other part of that was the restrictions. There wasn't any per se set occupancy restrictions, but there was social distancing requirements put in the plan still. And
Okay.
so those were removed from churches and also restaurants.
Okay.
And so with that, restaurants will be able to seat folks in every chair versus keeping everybody 6 foot apart.
Right.
So,
And we're getting ready to come up on spring break. And I know a lot of students here at Missouri Southern are going to travel out of town, take vacations. Does the city have a plan in place for, when they come back and bring, COVID cases, I guess? Is there a plan in place to track that or maybe put the mask ordinance back in place?
sure. So we don't necessarily have a plan per se as far as a exact trigger number, but we do have a way to track the number of the cases. So as the laboratory reports come in, we have a way to watch that. And spring break is a concern. COVID numbers are definitely better, but we still have COVID out there. So we will watch that. Hopefully it won't be a issue. Hopefully we've got enough individuals vaccinated now and enough people have had COVID and to where it will kind of help protect us on both of those fronts. But it's definitely a real possibility. So we are watching those. Once if it climbs up to the levels that it was in the past, at that time we would analyze data and then make any recommendations
Right.
at that point.
Okay. Well, thanks, Ryan, for joining us. We'll take a quick break, and we'll come back in just a minute, and we'll chat with Medical Services Coordinator Cynthia Burnham. Thank you.
Always ready, always there. Visit NationalGuard.com to find out more.
Joining me now is Medical Services Coordinator Cynthia Burnham with the City of Joplin. Cynthia, thanks for joining us.
Well, thanks for having me.
You bet. So we were talking to Ryan about everything COVID. The city has on their health department's website a place where people can look at vaccination clinics. But I think right now it shows the tier system. Can you talk about that just a little bit, the different tiers?
Yes, the tiers have been more on healthcare providers and people over 65 or those with high-risk conditions, but it is opening up on March 15th to the next tier, and that will include basically essential workers and essential operations to keep things going. So we do have a list on the website that shows if you would qualify. And there will be further clinics, not only through us, but through pharmacies and other areas where you can go in and get that vaccination when that's open to you.
And you said people can sign up with text alerts. How does that work?
Yes, if you go to our website, joplinmo.org, you can click on Newsflash and then select City News. And from there, it will let you enter your cell phone number if you have a smartphone, or it will let you enter your email address. And you will get alerts when we are opening up clinics so that you can either call in or log on and you can get signed up for a vaccine.
Okay.
There is also public news announcements, so if you don't have access to a computer, you can either get somebody who does that will help you get in for a vaccine, or you can just watch the news and be ready to call that number when it opens up.
Yeah, because some elderly people don't.
Yes, they struggle with that,
Yeah.
but most elderly do have grandchildren, neighbors, et cetera, who can help them with that.
Okay. And so do people sign up by going to, you said mo.org?
JoplinMo.org, which is the Joplin, Missouri website.
Okay.
And it's there that they can do the news flash and city news.
And what about through the state?
The state has one COVID vaccinator, and it is one that clinics can go to draw names of people to get signed up for, and it's through the State Department website in Jefferson City.
And if they go to their doctor, is that how they sign up and then they can come to the city? Or I'm not exactly sure of how that all
At
works.
this point, we have not pulled from Vaccine Navigator.
Okay.
We're just using our city website.
Oh, okay.
Each vaccine provider has the option to sign up for Vaccine Navigator if they choose to, and it's a brand new system. I believe it just went live to schedule appointments about a week ago.
Oh.
So that may be something we look at in the future, but right now we're just doing it through our city website while our vaccine numbers are lower.
Okay. And have you been vaccinated?
I have.
Yeah.
I've received both my vaccinations.
And no problems?
No problems.
'Cause some
I had
people are
minor
scared of
arm
that.
pain. I had minor arm pain, but nothing more. There have been some people I've known that have run a low-grade fever, just been really tired for a while, had some muscle pain. But I think the important thing to remember is most of us know someone now who has had very severe COVID, and it's believed that the immunity built up through the vaccine will help to protect you from that, and the symptoms of the vaccine appear to be much lower, less severe than contracting COVID itself.
Right. And how many shots does the city have or have access to?
Well, that varies each week. Okay. We get allotments weekly, and the number just depends on how much is coming down from the state to each department. They've also just recently opened it up, and it's now going to pharmacies in the area. There's a lot of local pharmacists that have it, both hospitals, health departments. So the good news is that the options to get the vaccination are growing every week.
That's really good. So that's, they can go to joplinmo.org and they can click on that COVID-19 button at the top.
Yes.
And that will give them the tier system. And if there are vaccination clinics, they can sign up through that as
and
well.
it will and like I said, I think the important thing is to know when it's going to open up, because there aren't appointments there all the time.
Right.
When we open up a clinic, it populates, and then they can just schedule their own appointments.
Okay. Well, we appreciate you coming out and talking to us about it. Everything COVID. So thanks to the City of Joplin and Health Department Director Ryan Talken and Cynthia Burnham for their participation today in the new Newsmakers. And now we're going to take a look at what students around campus, faculty, and staff are feeling about the current environment and COVID as we take the pulse of the campus community. We'll be back after a quick break.
Hi, I'm Megan Daniel, and you are?
Logan Baker, a second semester junior here at Southern.
Hannah Young.
And what grade are you in?
I'm a freshman.
Cameron Dodsworth.
And what grade are you in?
I'm a sophomore.
And have you gotten the COVID vaccine?
Yes, I have.
And what are your thoughts about it?
I got it because I'm working in a lab where we test for COVID, and so I had to get it for work, and I felt fine afterwards. So
I have not yet gotten the COVID vaccine. If I had the opportunity to do so, I don't know if I would yet, just because it's not necessarily like demanded everywhere. Maybe if that becomes a thing in the future, I would go out and do that. But as of right now, I don't really have any plans to.
I have not got it, and I've kind of weighed my pros and cons of getting it. So I honestly have no idea if I'm going to get it yet. I think it kind of just depends on what studies come out and what happens with it.
Do you think the City of Joplin is over-exaggerating with their measures, or do you think they're not doing enough to protect the residents against COVID?
Honestly, I think Joplin's done a fairly good job so far, all things considered. I don't think I'm on either extreme. With the new mandate just being lifted, I think it's good timing because I feel like the situation as a whole is starting to slowly get better.
I think that Joplin has done what they should, and I think that it should be up to everyone what they decide to do with how Joplin does it as a community, but I don't think that Joplin has done a bad job with it so far.
What are your thoughts about Joplin ending the mask mandate but still having to wear a mask on campus?
It's understandable. At the end of the day, it's up to the board here and what their overall decisions are, so I'll respect it. So.
I mean, I think since we're all, the younger group is still like, we can get it and be pretty much fine. I feel like that we don't really need to wear them.
I think wearing a mask on campus, I think it's just a great safety thing to do. I don't think that it's anything bad or anything negative, and I think it's a thing that the campus should keep doing.
And what activities are you ready to get back to normal post-coronavirus?
I definitely would say sports events. I'm ready for sports events to be back in full swing and no limited capacity and just have a good time with it.
I would love to see like normal sporting events, normal classes where they're not split up into A and B. That gets kind of difficult between all the different labs and other things. So.
All right.
For me, it's basketball. I've always loved coming in here just in the student center and playing basketball almost every single day. And then on top of that, just travel. I'm ready to go around and see some of the world again because it's been shut down for too long. So.
Our next guest is Rodney Rambo, Executive Director of Crosslines Ministries of Joplin. Thanks for joining us, Rodney. So what's the best way to describe the status of the food bank right now?
Yeah, so best way to describe it is busy. So it's certainly been a busy year, but overall things are good. We've had one of the blessings in a year full of many difficulties has been just increased involvement from the community. So we've had a lot of people that maybe didn't think about Crosslines much before who have pitched in, and we're continuing to see that, continuing to promote that because the need never goes away. It has been both a difficult time, but also it's always cool just to see how Joplin responds to times like this.
Yeah, and the Joplin four-state area, it's been hit hard by layoffs and shutdowns, big companies. And probably it ebbs and flows through the year. But how has Crosslines been affected by the COVID-19 pandemic with the downturn in the economy?
Yeah, I think one of the things that's been unique to us this year, and probably this is true of a lot of places, we've just seen a lot of people who need that assistance for the first time ever. That's this year we've had maybe more people than ever before who have come in our doors having never received any kind of assistance. I mean, people who would have been considered, well off just months ago who are for the first time needing that hand up. And so that has increased our number dramatically. But it's also been it's just been encouraging to see like that's what we were intended to do. Crosslines serves the working poor in our community. They serve those who are working when they come across a time of crisis. And so this year has just really exemplified that mission.
That's great. And so there was a lot of kids that weren't in school for a long period of time. Did that have any effect?
Absolutely. I mean, that probably, when you talk about kind of times a year that we have the greatest need, most of the time that coincides with kids being home. If you have kids, I've got a few little ones. Our grocery bill goes up tremendously, when they're eating a couple more meals a day at home. So yeah, kids being home, that doubles, triples, quadruples the amount of groceries families need.
Yeah, because they're hollow. Like they just keep putting
putting it in, and those people. A lot of people don't think too much of it, but having those 2 meals a day that are provided through the school makes a huge difference for folks that are just barely getting by.
Yeah, well, I'm sure they appreciate your assistance. And a phrase we hear a lot now because of the pandemic is food insecurity. Mm-hmm. But like we discussed, that's pretty much your job all the time.
Yeah.
Is there anything that changed besides that the need increased? What else? Is there like a silver lining here?
Yeah, I think for me, kind of the way we look at food insecurity, the way I would describe that to people is, food insecurity really it's a way of describing folks that have to make difficult choices in order to have food. You know, most of us, we don't think about those kind of choices. We don't think about, do I pay the water bill this month, or do I put gas in my car? You know, do I buy groceries, or do I pay rent on time? You know, but for a lot of our folks, that's exactly where they're at. I mean, they have to make those really difficult decisions. And so this year, during a year when everybody's been kind of behind and everybody's short and a lot of people have lost income, those choices just become even more narrow, you know. So that's been what we've seen. We've seen families more desperate than ever. We've been around since 1984, and in November we saw the record for the most people we'd ever seen in a single day. We had over 200 people come through the doors of Crosslines because people were just desperate, and that was in November. You know, their kids are getting ready to be home on break, and people are just really feeling that desperation.
Yeah, and most of the people in our community know what Crosslines is, but can you tell us what your mission is?
Yeah, so Crosslines, we are a ministry of the local church in Joplin. We were started by about 12 local churches that kind of decided we were better together than we were apart, and that's grown to encompass about 55 churches in the Joplin area who all pitch in and make this happen, and we exist to offer, you know, a hand up during that time of need. So for folks that come across a financial crisis, whether that be, you know, for a lot of our folks, you work really hard, but then the transmission goes out in the car, the fridge has to be replaced, you get laid off from work, and, you know, a lot of folks just don't have anywhere to turn when that happens. And so that's what we exist to do. We are, you know, basically set up like a small grocery store, and when you come to Crosslines, you'll get, you know, a couple of weeks worth of food for your family in a grocery store type setting. And and then we also help with clothing and houseware items as well.
Oh, that's great. And so tell us what your hours are and your information of how people can apply for assistance if they don't already know.
Yeah, so we're open on Monday evenings from 4 to 7, and then Tuesday, Wednesday, and Thursday, we're open from 10 a.m. to about 1:30 p.m. Wednesdays are a day we distribute government food commodities, and so that's all we do on Wednesday, but Tuesday or Thursday, we do our crisis food pantry just for anyone who qualifies for that. To learn about qualifications, you can go to crosslinesjoplin.org. Kind of a basic rundown of that. You have to live in Joplin, Webb City, or Carl Junction school districts. You do have to income qualify, so when you come to Crosslines for the first time, we need a pay stub, we need some kind of utility bill or piece of mail that proves that you do live in those areas, and then we need a social security card for each person in the home just to confirm the number of people in the home. So those are the items that are needed. And
well, thanks for letting us know that, because I didn't know that about the information that's needed when they come in.
Yeah.
And you said Wednesdays are government.
Yeah, so we distribute commodities, you know, which is part of it's a federal program we've done for many years, where it's a little bit of food that is meant to subsidize food stamps. So if you're receiving, you know, food stamps, government benefits, you income qualify, it's just it's the only service we have that is ongoing. It's the only thing we have at Crosslines you can do each month, but it's a small, humble amount of food. Just kind of meant to help bridge the gap. Yeah. So all of our other services are kind of crisis-based. They're not meant to be ongoing, but that is the one exception to that, and we do that on Wednesdays.
Okay. Well, thanks so much for joining us, Rodney. We really appreciate it. I want to thank Rodney Rambo with Crosslines and Ryan Talken and Cynthia Burnham with the City of Joplin for being with us. This is the new Newsmakers on KGCS TV from the Ruth Colpin Studios here at Missouri Southern State University. I'm Bobbie Pottorff, and we'll see you soon.